Speaking of things to look out for, there's some chronic issues a lot of us go through, and that's why we have a health segment like this one. Today on Health, we're going to be getting tips from Dr. Kuti Olatunde. He's a certified medical practitioner, someone who's worked in both public and private sectors. Now, he has a very keen interest in public health, and he's one of our favorites on the show. We're talking chronic back pain today. And for those that don't know what chronic back pain is, Dr. Kuti, please give us a little breakdown.
Okay, back pain is the pain that you feel from your rib cage downwards. So
from your rib cage,
yeah,
okay?
Downwards.
So rib cage, that starts from like just below the armpit, I believe, right?
Yeah, just below the armpit.
Okay.
It beats further down though.
Okay.
Then downwards is
Okay.
back pain. And we use the word chronic is when the pain is persistent for at least 3 months
Okay.
or more. Then we use the word chronic. Anything less than that is not chronic pain.
Okay. So back pain feels like, not a lot of people go through it, but there are some people that go through it continuously, constantly. You just mentioned 3 months. So for people that have back pain that comes back once in a while, maybe over a year, is that still considered chronic?
Well, no.
Okay.
So, like almost everybody feels back pain. So you can feel it for 2 days, 3 days,
Okay.
it goes. Then it recurs again maybe after 5-6 months. That's not chronic.
Okay.
So that's an acute pain that comes on a regular, recurrent acute pain.
Okay.
Or when it comes persistent, you're using medication, the pain just doesn't go, then it becomes chronic for at least 3 months.
Okay, so now, who are the people that are more susceptible to having chronic back pain?
In terms of gender, both genders are
Okay.
susceptible for having chronic back pain. But people that does things like carrying of heavy loads regularly,
Okay.
people that do rigorous exercise,
Okay.
they are involved in exercising themselves too much.
Okay.
People that their work station isn't too conducive, their sitting position is not too good, or people that sit down for too long.
Okay.
Those are people that are prone, or obese people, yes.
Okay.
People that don't watch their weight, those are people that are prone to having this chronic
So
back pain.
obesity,
Workstation.
a workstation that's not perfect. So can we talk a bit about the workstation now?
All right.
Because a lot of people work in offices or have an office at home. What do they need to look out for to avoid,
So-
getting back pain?
Your sitting chair is very important, and how you sit while walking. So you're expected to always stretch your back.
Okay.
So people that sit and they are bending their back, they're on the system a lot, they are prone to having back pain
pain.
because they are changing the alignment of the backbones. You understand? So your chair should be comfortable and should allow you to stretch your back.
Oh, yeah.
Yeah. Then also the posture of where your system, most like your laptop or your computer, the position in which you place it, how comfortable is it for you? Are you bending to type or you're sitting upright? Then also, how often do you stand up to walk around your workstation? If your job requires you sitting down for so long, those are pointers for having chronic back pain.
Okay. So now, is there a specific age group that go through this more?
Well, starting from 30 years old,
Okay.
yeah, you start to have these little pains. Sometimes you ignore, you don't take note of it. But from 30 years old, you need to start watching all those the signs and symptoms.
So a lot of people are going through this and they've been using like over-the-counter medication. They just self-medicate and they just believe, don't worry, that sachet painkiller, I'm not mentioning the name now, is enough. Don't worry, once I take like 2 of this, I'll be fine. But for those who have been ignoring it and they haven't gone to see a doctor for maybe years now, what are the implications of that?
Okay, the good thing and the bad thing. Okay, let me say the good thing with that medication is yes, it will give you temporary relief.
Okay.
You feel that the pain is gone. If you don't address the root cause, it will get worse along there, and it will get to a point the pain medication won't be able to help. And before you know it, the pain becomes persistent. It's not affecting other parts of the body, especially some people they'll have problems lifting their legs or standing up upright and all those. So the first step is once you're having that pain, make sure that you address the root cause.
Okay.
Try to see the doctor. What's causing this can be as little as your workstation. So you just need to adjust your workstation and you find out that you are fine. You don't need to use the medication. It can be as little as your weight.
Okay.
You just need to lose your weight and everything is fine. So you need to address the root cause before you can now say, oh, let me start using medications,
Okay.
or let me start physiotherapy or other form of treatment.
So what is the worst case scenario now? Because people think of back pain, it's just pain in my back, don't worry, I've been going through this for years. What is the worst case scenario if you don't go and get checked out?
The worst case scenario that can happen, there can be paralysis of the leg, of the limbs,
Wow.
if you don't take care of it, depending on the cause. Some people might not be able to stand upright again. Some people, it depends. If you have something like osteoporosis, can have fracture of the backbone.
Okay.
And yeah, those are some of the complications that can arise from not treating it adequately.
Okay, so now this is someone is watching right now and they've decided, you know what, I have to go and see Dr. Kuti and find out what this is all about. What's the first thing you ask them to do?
Okay, I would want to, when did the pain start? Because the description of the pain is actually very important.
Okay.
The pain can come from dull to sharp. It can refer to another part. So it depends. I want to get perfect description of the pain, how we started. So that will help to know, okay, the root cause. So for some people, I want to trace it and investigate whether it's a workstation that is causing it,
Okay.
whether it's your job description that is causing it, whether it's your weight that is causing it. And in some cases, funny enough, it can be some disease process. For example, cancer. So it can be cancer to the backbone, and that is caused. So the first thing as a doctor is you have to properly ask questions to investigate where the root causes come from. And from there, I can move on and say, okay, we do this investigation. Let's know how bad it is before we can now salvage the situation, know the right treatment to give.
Okay, so I wanted to ask, you mentioned age 30, and that one just maybe do like this, but the issue is there are probably people younger than 30 that are going through that. They're probably not doing harsh exercise, and maybe they're not doing some of the things that older people are doing now, but what could be the cause for younger people to get back
Well,
pain?
younger people having back pain, most times it's going to be acute, like I said earlier. It happens for a short period of time
Okay.
and good. But in some cases, it can be chronic as well. And things that can cause it, like I said, cancer can cause it. You can have arthritis at a very young age. You can have fracture of the vertebral bones, that's the backbone,
Yeah.
at a very young age that you don't know, probably when you were exercising yourself or
Wow.
playing football. Or maybe the person had an accident and there's a minor fracture that the person never took note of. So those are little causes or non-important causes that you are not taking care of.
So we need to make sure we stay, make sure I was going to say stay safe, but what I'm trying to say is make sure we go and see our doctors to find out that whatever is going, whatever we're going through is not something more serious. It's not just back pain all the time. Dr. Kuti, thank you so much for coming to talk to us. We're going to be right there on social media for your questions. Just use our hashtag WakeUpNigeria on TVC. And we're going to be taking a quick break. We'll be back after this.